There's certainly a lot of conversation around changing the name, and various names have been broached. The most common is to rename it as a trauma disorder of some form. The reality is that whilst many people who experience BPD have experienced trauma of some sort, a number haven't. So research is showing that there's actually no real correlation. There's not a causative effect of one to the other. Renaming BPD to a trauma disorder doesn't seem to really correlate at the moment. However, we do know that people with BPD can experience a trauma disorder, and it's about 60%, I think, that actually experience what's known as complex post-traumatic stress disorder. And the number of people who experience complex post-traumatic stress disorder that also have BPD is around the 10%. So it's quite possible that a person will have both. So it might be BPD, it might be a trauma disorder, or it might be BPD and a trauma disorder. Because there are some different behaviours between the two that currently are sort of being looked at as ways of differentiating. So people with BPD tend to have quite poor relationships. There's often quite intense idolisation of a person and then some devaluation. People with a complex trauma disorder tend to try and avoid relationships.